The highly anticipated report on the health behaviour in school-aged children, or HBSC, was released today at a public launch event in Edinburgh, Scotland. The study used data collected from 11, 13 and 15-year-olds from 39 countries and regions on 60 different topics related to their health and well-being, social environments and behaviour. The report shows dramatic changes during this 5-year age span and pinpoints adolescence as a time of huge opportunity.
It's shown you that this rich data source can be translated into useful intelligence to inform and guide policy, to improve health of young people, to limit the impact of inequalities and to encourage investment in this age group as well as the early years.
In WHO, we can ensure that young people and their health is taken into consideration also in our development of the Health 2020 policy. We know also that we have a major report coming up on the health divide in Europe, and it would be obvious to use HBSC data to actually pull out some of the information that is essential in order to look into the health divide.
The HBSC report is unique in the world as a comprehensive picture of young people's health and well-being, and it is vital as a sound body of evidence on which to base policy.
So in the end, what does it tell us? It tells us that we've got a report that segments the market for policymakers and those who deliver the outcomes to people. McDonald's, the big alcohol companies would bite your hands off for this.
While the HBSC report shows positive trends in adolescent health in some areas, it also provides insight into why health-compromising behaviour, such as smoking and drinking, continues to be an issue during the adolescent years.
The really special thing about HBSC is the context information it provides to look at why these, what these differences are, but why they exist. You can have two countries with very big differences between boys and girls in drinking, and in one case it might be risk-taking, it might be rebellion, in the other it might be just plain and simple having fun with their friends, or that's how they perceive it. And the contextual information collected by HBSC at different ages, and it's going to help you get behind that, and that will mean very, very different policy interventions.
You know, there's this huge gap where actually there's not a lot of social options outside doing stuff like that. You don't have activities at night. People are on the streets because there's nowhere else to be, and people do drink because it's the only way they think they're going to have fun on their Friday night when there's nothing on TV and they don't really want to stay in by themselves. So there's that huge social factor to it, as well as peer pressure and as well as the kind of fun factor of it.
So use it. Don't just leave it to the politicians. Don't just leave it to those of us who work in health. Don't leave it to the policymakers. You guys go back to your school and you get this and you say to people, we could use this for other things.
Most of the children, most of the time, in Scotland, grow up to be reasonably well-adjusted adults. Well, quite frankly, that's just not good enough. What we should be is a society that's got ambition for all our children, all of the time, growing up to the best adjusted adults that they can possibly be. And the material that we've been looking at here today provides some of the answers, some of the clues about the kind of things that we should be doing to realise that worthy ambition.
WHO Regional Office for Europe in Edinburgh, Scotland.